But I think that's the biggest misconception. I think a lot of people are just afraid that it might hurt the baby or even hurt the mom or cause any kind of issues. But chiropractic has definitely advanced quite a bit over the last 20 years.
What's up, guys? Hey, everybody. Welcome to Coffee with the Chiro. I got my coffee here. We're ready to roll. Caroline, we got us a new guest today.
Oh my gosh, I'm so excited about this.
Yes, we do. So we wanted to, first of all, thank y'all for following us in our podcast. We've had a lot of guests so far and just some great information. And we have Dr. Tyler Sandstrom here with us today. He is one of our main doctors at the Straw Clinic, as well as he works in Morristown and also Dandridge. So he's kind of rolling around these places. He is a graduate of Sherman Chiropractic College. He graduated 2 years ago. Hopefully, I'll let him share a little bit about his experience at Heskett Family Chiropractic. But today's topic, we're going to talk about pregnancy, Caroline, and how it is essential if you are pregnant to have your spine checked to make sure that you are clear from subluxation. And you can tell behind me, I am in the country of Mexico this week, but work never stops, Caroline. She's what? Got to get on this podcast.
Right.
So I'm over here, just left the beach, and we're going to do this podcast with Dr. Tyler as he's moving bones back there in Knoxville today. So we're gonna talk a little bit today about pregnancy and how it relates to chiropractic. And before I let Caroline ask the first question, I want you to know that Dr. Tyler is certified in Webster technique, which is a technique we don't actually turn the baby, but it's a technique where pregnant women can come in and we can adjust the spine to create space in the womb for the baby wants to be head down. So he'll share a little bit about that. I hope we'll have questions about the Webster technique. If you if you are pregnant, by the way, we have tables at our office that allows you to get adjusted while you're pregnant. That's one of the greatest things about coming to the office when you're pregnant is that your belly can drop. I know, Caroline, you got adjusted while you were pregnant. Your belly can drop into that table, and you can relax, and it's just a great thing. Also, Dr. Tyler did advanced courses on pediatrics while he was in school, and he does a lot of adjusting in our office on kids, with kids, and he puts them in a little pillow from all the way from right after birth. We've had patients come in the office right 3 to 4 days after birth.
Yes.
And just for a gentle correction for their child. And so, Caroline, I'll let you take it from here. Dr. Tyler, it's great to have you on with us today. We're excited to hear what God's going to do through this call. Caroline?
Yes. Okay, so let's get down to it. I am so excited about this. Obviously, I'm a mom. I've got 3 little ones, so this is up my alley, and I'm excited for my mom friends to hear this. So first and foremost, Tyler, what made you take an interest in, even more so, in pregnancy, pregnant mamas, and babies? Was there some reason that drew you to those?
Yeah, first of all, thank you for having me. I am really excited. This has definitely become my heart and soul. Like this is my favorite topic. These are my favorite patients, just because of the miracles, the results, the relief that we've seen with it. Um, but yeah, so my story actually started when Dr. Heskett adjusted me the first time when I was 18 years old. Um, I grew up with a lot of anxiety, a lot of mental stress, which caused a lot of gut issues. And as a baby, my mom told me I was the worst baby. She was a labor and delivery nurse, and she said I was the worst baby she's ever seen because of the colic, because of the gut issues, because of the leaky gut. Um, and after starting to get adjusted by Dr. Heskett, a lot of those just went away naturally. I mean, a lot of the stress started going away through prayer, but a lot of my gut issues and mental stress, anxiety is completely gone. And it's something I don't even struggle with much anymore. So when I got to school, I wanted to dig into that and see, obviously as an adult patient, the results that can happen, but me knowing how bad of a baby I was, I wanted to figure out how I could help in that realm. And so I definitely connected to a lot of those classes and took a lot of those classes to learn how to effectively do this. But even after school, the thing that like really lit my fire was in my first month of practice. We had this patient come in. She was 42 weeks pregnant,
Oh my God.
no contractions, no signs of labor ready to happen. And I was the first person to see her, just because of our normal, flow. I was the next one up to see her, and basically just did a Webster check on her and just did what I knew how to do. Didn't do anything extra other than Webster. And I'm not kidding. 3 hours later, she had the baby. And the next 2 days later, she pulled up to the office. Her husband came and grabbed me and said, "Hey, I want you to meet somebody." Took me out to the van. I got to meet the whole family. And it was like from that moment, everything I knew, like it really fueled the fire for me to dig deeper into this and really focus on it.
That's amazing. I mean, I that just pumps me up so much, and I feel like gives such hope to moms, especially expecting moms who one have either heard all they hear when they're pregnant are horror stories and how bad childbirth is, but that is so far from the truth of what it actually can be. And you being able to help in chiropractic care in pregnancy is such an amazing tool that can be utilized by every pregnant mom.
Hmm.
So I love that. That's incredible. And I mean, you just touched on like one of the reasons, and like it literally ignited childbirth for that mom. So, what are some of the other benefits or top benefits that you would say chiropractic care helps with when a pregnant mama comes in?
Yeah, absolutely. So I went back. So I'm part of ICPA. It's the Pediatric Association in which I do all my courses. And I went back on there. It's a great resource if anybody is interested in any kind of pediatric care or pregnancy care to check it out. There's all the updated research. And so a lot of what I want to share is actually just the most updated, things that we have with the ICPA. And basically for a mom, we focus on three things. It's power, passage, and passenger. Power being the most important. It's the heart of chiropractic. It is making sure that the nervous system is turned on. It is working 100%. Making sure that the hormones are regulating properly. The brain is communicating to the uterine line and communicating to the baby so that everything's connected. Passage, obviously, the passage that baby is going to go through. There's a lot of pelvic and sacral misalignments due to the hormone called relaxin. Every mom has relaxin when they're having a baby, and it does exactly what it sounds like. It causes everything to relax. But that can cause a lot of those shifts. And so we got to make sure that everything is in alignment so the passage is at the best it can be. And obviously, the last is the passenger. I know Dr. Heskett just touched on it. We don't say we turn the baby or anything, but what we do is we make sure that those ligaments and those bony misalignments are in place to make sure that baby has the best position possible to be face down, turned backwards, so that when labor hits, it's go time. And I wanted to share real quick because it just happened today.
Yeah.
I took care of this mom from the beginning to the end of pregnancy. She came in the day of she was going into the hospital. 2 weeks before, the baby was transverse. 1 week before, he was face down but turned the wrong way. The night of, he was turned the right way. And I got to check five-day old baby today. And she said that once labor happened, this is a quote.
Yeah.
She said he slid out.
That's the best. That is so what we want to hear for those moms. Yeah.
So awesome, man.
Yep.
So just real quick, I was thinking, Dr. Tyler is. I hope he's going to be there for our Women's Night Out. I was just thinking, we're going to cover a lot of these things during that Women's Night Out. We're going to have some great speakers that are going to be there, and Dr. Tyler's going to try to be there as well and answer any questions. And not just so you know, too, this is Dr. Tyler's heart, but all of our doctors are trained to locate and correct subluxations in the spine, regardless of, we say from womb to tomb. So regardless of how young or old you are, try to come to that Women's Night Out, April 25th. We have a special guest coming, Dr. Terry Harmon from Kentucky. And also, we're going to have Dr. Edie Wadsworth at that. So next question, Caroline, for Dr. Tyler. This is awesome.
Yes. So a lot of times, when I'm talking to other moms or people that are pregnant, they're like, I didn't even know pregnant moms, or, if you're pregnant, you could get adjusted, or I didn't know you could adjust a newborn baby. So I think a good question would be, is it safe for pregnant moms and babies to get adjusted? And also, you can touch on this too. What are some of the misconceptions, that you hear when moms come in the office asking about care?
Yeah, I mean, safety is a number one concern for any mom, pregnant or not. Safety is always number one. And so, we use drop tables in our offices, and like Dr. Heskett said, these drop tables can actually drop further down at the belly. And so, a lot of moms that come in and they're like, I haven't been able to lay on my stomach for 38 weeks. This is so comfortable. So it's safe. It gives space for the baby. We can move different pieces of the table to make it more comfortable. But the drops are extremely light. We even do a little extra pressure with our knee to make sure that drop's pushing through, so that we can get that movement in the bone real easily. And like I said, I mean, everything's super relaxed, so it doesn't take a lot to get even the most minor subluxation fix.
Mm-hmm.
And then when it comes to babies, the best way I like to describe it is the pressure we use on an adjustment for even a newborn is the pressure that you would touch a baby bottoms with. But what ICPA always says is it's the pressure that you would touch your own eyeball with, without feeling any pain. So it's extremely light. They're sustained pressure contacts on babies. We're not doing any pushing, any rotating, anything crazy like that. Because at birth they're about 90% cartilage still, but that cartilage is still protecting the spine and the spinal cord, and those nerves. And so, but it's real light adjustments. But I think that's the biggest misconception. I think a lot of people are just afraid that it might hurt the baby or even hurt the mom or cause any kind of issues. But chiropractic has definitely advanced quite a bit over the last 20 years. And those drop tables being the biggest of them, as well as some of the instruments that we use, that allow that safety, to be secured for that mom.
I have a question. So when you're checking a child, let's say 5 days old, 10 days old, 2 weeks old, um, do you find because you got to check before we can correct, right? So
hmm
do you find, like, what's the percentage you would say you find that these children are out of alignment or have an alignment, and also what is the primary area that you check?
Yeah, absolutely. I would say almost every baby I've checked, whether it be brand new or a few adjustments in, there's almost something always going on because the development process is happening. That baby's growing and it's changing, and that's what chiropractic is about, is helping people adapt to stress, including babies. The main areas that we see, and we can dig deep in this if you want, but it's the cervical spine and the sacrum, especially during deliveries. Even the most natural, healthy, quick vaginal delivery is still stressful. If you've ever seen a video of a baby deliver or got to experience, there's a lot of twisting, there's a lot of turning, there's a lot of pulling to allow that baby to come out as quickly as possible. And I was looking at some pictures on the website, just looking back at it, and some of those grips they have just to get that rotation, it's intense. And so that's why the upper cervical goes out. And same with that sacrum, that last little bit where they're getting out, that sacrum can get twisted up. And those are the most important for a baby because that is the rest and relax
Right.
areas. That is where the body is at ease. The upper back is your fight or flight. And so we check some things in the T-spine on babies, but it really is the rest and relax because a lot of babies are dealing with colic or upset stomachs, rotation issues, some benchmarks they're not meeting, and so we want the body to be at as much ease as possible.
Yeah, I want to say too that if your child was born C-section or forceps was used, I think forceps are pretty much a thing of the past. However, they were not a thing of the past when I was born, some odd 51 years ago. Whew! So, I mean, if you were, just think of that as an adult about that first subluxation or that first misalignment. If you had a C-section, there is really, and I understand a C-section, it's a surgery. So,
Right.
they have to get the baby out. So when they make the incision, they reach in. If you've not seen, because a lot of moms don't see their C-section. Some do, but some don't watch it. They come in, literally grab the head, pull the head out, and there's twisting. Sometimes a huge amount of twisting. So if your child was born C-section, or you had a long labor, it is essential that you bring them in and have them checked. Caroline?
Yeah, I completely agree with you. And I mean, I even had three of the best experiences that you can say. I can't tell you one bad thing or negative thing about any of my births, but I still came in with those babies and were like, take my baby, get them adjusted. So I can only imagine, anything even more so than that would be traumatic just on that little baby, and we want to get them adjusted. So what Dr. Tyler just touched on is my next question is some of the things that can happen after birth. Even a little trauma on a little tiny baby can be a lot or can cause a bigger issue. So what are some signs or symptoms that moms can look out for, especially in the newborns, that they're thinking the light bulb goes off like, ooh, maybe I need to bring my baby in to get adjusted. Maybe it would help.
Yeah, there's so many signs. A lot usually leads to the gut. I mean, the gut is the number one line of defense for the immune system. So, baby trying to their immune system's adapting, their gut's already under a little more stress because it's working overtime. But going back to that sacrum, those nerves are what control the gut. The lumbar spine is what controls the gut. So any irregularities, constipation, colic is a big one. If they're constantly sick or throwing up, spitting up more than normal, a lot of people notice trouble breastfeeding, either not latching or favoring one side more than the other is a big one that we see. If they're throwing tantrums and you can't really figure out, what's going on, babies have headaches, and you can't ask a baby if it has a headache, but if everything else is good and that baby is crying, there might be a chance that there's a C1, C2 misalignment, or even the skull that is putting pressure on that nerve and blood supply. So those kind of things. But then once again, like Dr. Heskett said, any kind of abnormality during that labor and delivery can be the first sign to get the baby checked. And then back to the immune system, ear infections and cough and coop cough and things like that. If the baby is being sick more often, that means that immune system's just not fighting as well as it could be.
Yeah.
Yeah, Caroline, I want to interject here and share my favorite pregnancy testimony. I think you'll think it's funny. When Marge and I first started out in practice, I was young, probably 26 years old, and we had this patient come in, was unable to get pregnant. She told me she tried everything. She tried for 3 or 4 years, just nothing would. It'd be so cool if she was watching this podcast. She could reach out to me, because I can't even remember who it was. This is 25 years ago, but the story goes, we just said, we don't make promises, on these things, because only God knows. But we told her that we check her and X-rayed her and saw that she had some subluxation L5 and the areas that supply and produce the reproductive organs. I said, you do have some issues going on in your low back. I was like, you're going to be better off if you don't have subluxations than if you do. So I'm literally, how 3 o'clock is at our office, Dr. Tyler, like all these people are in there and stuff. And she walks through the front door and says, Dr. Heskett got me pregnant. I said, oh, Margie's there. She goes, huh? I said, no. So I was like, I think you need to rephrase what you're saying. Yeah. But anyway, she was able to have a baby. And so, it's just amazing. It's a miracle what the human body can do when it is free from interference. And that's what we talk about on here. And so, like we said, we don't, that wasn't our intent, but when you get pressure off the nervous system and allow the body to function at its optimum, God can just do amazing things. Any other questions for Dr. Tyler?
Yeah, the last one that I would ask is, if there is a pregnant mom on the fence and it's like, I don't know, should I come in, or how's it going to go when I come into the office? Do you have anything encouraging to share with her, or just to bring her into the office?
Yeah, I mean, we see a lot of moms that sometimes we're the last stop that they make, and they've exhausted all options, and they're just there, just hoping something can help them. Um, and it's usually in one visit they get up and they're like, "Oh my gosh, that was unbelievable! Like I feel so much release." And then we see those things, we hear those ultrasound reports, we hear the testimonies, post birth. So my encouragement would be, just give it a shot. I mean, it's worth just coming in and talking about. And we don't do anything until we talk to you and make sure you're comfortable and okay with what's going on. And usually kind of when we get through what we just talked about, most moms are on board. But it's worth trying and just having the conversation, first and foremost. But also hearing other people's testimonies. I mean, a lot of the moms that I've seen lately are friends of other moms that came in on their last leg. Um, and and I've had the blessing of seeing so many of my high school friends. They've come in because they're all getting pregnant now. And they're telling each other and they're bringing their newborn babies in because they're having the same issues and then they get the same results. And so it's created a little bit of a trickle effect, which is really awesome. Um, I wanted to ask though, Caroline, did you want me to dig into the Webster real quick and just
Yes.
talk about what we do, Webster?
I would love to finish on that, just about how that's different or just is more for pregnant women in general. Yeah, that would be
Yeah, so Webster is specific to the pregnant mom. There's some things that we check that we don't check on any other patient.
Mhm.
And so we always start with the sacrum and pelvic misalignments. We do a lot of leg checks and
Yes.
where we push the legs towards the bottom, and see which leg is restricted more than the other, because that's most likely, or it is the side in Webster technique that is pulling. That's the way the sacrum is tilting to.
Okay.
Um, but just as important as those bony misalignments, there's all these ligaments that are holding all the structures in place. And so the two main ones that we check with Webster, one's called sacrotuberous, which attaches from the sacrum to your ischial tube, which is on your pelvis. And that is part of the passage deal that we talked
Okay.
about. Because when that is taut, it can continue to pull that sacrum out and it can continue to affect that passage. But as important as that sacrotuberous is the broad ligament. This is, what Webster was created for, was to be checking this broad ligament. And it sits on the front of a mom's belly. It attaches. It's called a ligament, but it's not really a ligament. It's this big wing of structures and muscle fibers that attach from the uterine lining over onto the pelvis. And
Okay.
when that is out, that is more of the passenger, because that's what can decrease the space for the baby to be in the proper position.
That makes
So we focus a lot of energy making sure that those broad ligaments are loose, they're the same, they're congruent. And then a lot of other stuff we do with Webster is working on some muscles like the hip flexors and the piriformis that the sciatic nerve runs through, as well as checking the pubic bone. And you can ask Dr. Heskett, that's not something that we do on anybody else, because it's not something that usually is a concern, but it is, with the pregnancy, because any of those being tighter or misaligned more than the other can cause a lot of the issues that moms see during that pregnancy.
yes.
Oh, that's awesome.
100%.
And so we want to say that if you are pregnant and you're like, when you're watching this and you're like, well, what's the first step? We offer exam and consultation. Actually, through our podcast, we offer a special through the podcast, only through the podcast.
Mhm.
If you call one of our locations in Morristown, Rogersville, East Knox, or Dandridge, excuse me, you can just mention you saw this podcast, saw the pregnancy podcast. You 47. You can get the entire first visit. That's for moms. That's your initial exam, your consultation. Obviously, we cannot do X-rays until you have the baby. However, we will do X-rays after you do. But we are able to analyze you through posture, palpation, leg check to determine where your subluxations are. All you have to pay for that first visit is 47. And so we encourage you to do that. Or if you're just a patient and you're like, hey, I remember my mom said I was born C-section, or I have problems in my neck and I have headaches and sinuses and allergies and these things that I've had since I was very young, like Tyler was saying earlier, or gut health. Make sure you have your spine checked to see if we can help you and to see if you have subluxation. That was awesome, Dr. Tyler. Really
Yes,
good.
thank you so, so much. This is going to help so many pregnant mamas just answer their questions, feel at peace. I mean, this is such a big deal to get this information out. So thank you so, so much.
Yeah, and
Yes,
just
thank you for having me.
Yes.
yeah, thank you, Dr. Tyler. We're super excited to have you, and I'll say, thank you for everything you do at Heskett Family Chiropractic, and we're just so grateful for you. So,
Even taking
uh,
care of my crazy children that come in the office.
We love them.
Thanks, thanks. Me too. All right, guys. Well, listen, that is a wrap for the pregnancy podcast that we were talking about with Coffee with the Chiro. We're going to let Dr. Michael go back and enjoy the rest of his vacation. Dr. Tyler's going to head back out to the office, and I'm heading to go get kids from school today. So thank you guys so, so much, and we will see you on the next Coffee with a Chiro.